defective illness. What is this defective illness? Why this title he was given to this just a small booklet of 72 pages actually. So right, so in this book, we generally covers more part of organon of medicine at the first, the application part of organon, and the mere aphorisms from the organon 6th edition, how Hahnemann has described, that was written at the first in the part one most probably. Coming into the part two of these, there are some materiamedica remedies, the reactive remedies. Most probably he has concentrated on reactive remedies on 4 different parts of action, or 4 systems of action. Reactive remedies, according to him, is whenever we have taken the case and it is not at all helping with your constitutional remedy or with your pathological remedy or with your totality based remedies. So at that time, what remedies coming to action, how we can bring the reaction from the patient. Here, reaction to the remedy is nothing but the stimulating the vital force, according to him. So this is the gist, and from these also we are going to learn some of the rubrics he has mentioned and some of the remedies as well in depth. And after this session, we are going to share you the PDF and the PPT as well. So coming to the first from this book, so the expression of Ernest Crackington, which we find the interrupted in other translations of organon into France as a partial illness, which is course is a mistake. So this is what Hahnemann says. So Hahnemann, about this defective illness, he already mentioned in the aphorism number. Here paragraph he mentioned, that is nothing but the aphorism number. He has mentioned in 172. So 172 aphorism is more of one-sided diseases. So one-sided diseases is the defective illness according to Hahnemann. So what Hahnemann has mentioned here is a similar difficult in the way of the cure occurs from the symptoms of the disease begin too few. So whenever you take a case, you get very few symptoms, especially of disease symptoms, which is of one-sided. So in such cases, the prescription becomes very difficult. Circumstances that deserves our careful attention, for by its removal almost all the difficulties that can lie in the way of this most perfect of all possible modes of treatment, that he is to say, except that his apparatus of known homeopathic medicines is still incomplete, are removed. So here basically this aphorisms gives you information about one-sided diseases, how we can help the patient with one-sided diseases, where patient comes with very few symptoms, especially of diseases. Like I'll tell you for example. Suppose if a patient comes with you having infection or having symptoms exactly of spleen, he complains of spleen pain or pain in the spleen with some symptoms, but you are not getting any particular modalities or any particular aggravation or amelioration modalities, any particular type of pain, but patient is showing that in the spleen region I am getting some difficulty. So this is one sided. So here you need to apply the remedy which is very similar to the action of spleen. Like for example, here you need to mixture Ceanothus americanus. This is a doctrine of signature to the same remedy. This is pathological prescription. So generally in this one-sided, we need to have a basic knowledge of the sphere of action of the remedies and their pathological action. That is most important in prescribing in these one-sided diseases. So the illnesses which show only on one side or one aspect of the reality are called as Einstein-Crackington, which are not talking here about partial or fragmentary illness, because these are the illness which involve and represent all of the individual. Here you understand. So the symptoms of the disease is not about the disease. It is a symptom of the individual who is expressing something in front of you, that you need to catch hold of it. So generally we normally say, doctor, patient is not at all telling any symptoms, what to do? Use sulfur because it's antisoric, it will have some action, then patient comes to us and he will open up the case. Can be that are reactive remedies. But when you get one-sided diseases of remedies, like as I said in spleen cases, or if a patient comes with you lot of pain, especially the kidney regions, there are many remedies. Very, very vulgaris action exactly on the kidneys. sarsaparilla, lycopodium. So these are some remedies. So basically, in these situations, as a homeopath, we need to have knowledge on materiamedica with their pathological action or the sphere of action. So this is what exactly Burnett has did very beautiful. Actually, Burnett has given this organopathic remedies, which is very similar. Actually, it is not against homeopathy, but the first person who has introduced these organopathic remedies are Radmacher. He is from basically from Britain, and that was followed by Burnett. And Burnett cases, if you read Burnett literatures, almost all Burnett literatures are in this way of prescription, and he has get a beautiful results. He has shown beautiful results, especially in animals like horses at the time and in the people as well. That you need to understand. So that is why I called them as defective illness. On the other hand, oncolamine arithmetic potency, which means incomplete pathogenetic dynamization, which is a fragmentary drug that has not completely depended its action for what sufficient proving or for what of provers sensitive enough to react in all their facilities and organs. Right, so that is what these organopathic remedies or the disease pattern we are prescribing, oh, so and so remedy is not particularly proven. I'll tell you one more remedy. If you read from Clerk's Materiamedica, Syrinum, it's a cancer remedy, Syrinum. And Clerk's has mentioned whenever, if a case you having mammary tumors or breast tumors, either it is hard, soft, palpable, non-palpable, nothing. If it is there, prescribe Syrinum in low potency. If you read Clerk's Materiamedica, you'll understand this. So this is that is not well proven. So that's why he says it is incomplete pathogenetic dynamization. But it has some action to react or to get the vital force from the patient, to stimulate that vital force. There is other remedy from this action, that is Scrofloria nodosa, also works wonders, especially in these mammary tumors, especially with these mammary tumors. So these are some of the pathognomic symptoms or pathogenic prescription that we need to evolve in this during generations, where patient cannot able to describe symptoms, where patient cannot able to understand what actually homeopathy is, especially in the first setup, especially in the first setup. After first follow-up, second follow-up, patient come to know what we are doing, what exactly this doctor is expecting from him, then the case open up in a beautiful constitutional way. It is not the fault of the drug, but of the circumstances which have not allowed it to develop all of its potential richness. There are many remedies from Boric Metromedica, even they don't have any section of mind. They generally have the pathological symptoms. That the prescription is very, very helpful in such type of cases. Is it clear? Is it going well from my side? Are you all understanding? Please do text. Am I slow or am I fast? How it is going on? Are you all understanding it? Okay. So coming to the local melodies of local illness, which Hahnemann speaks about here, is about localized illness. The only local illness that we recognize in homeopathy are of traumatic, or of an injury, or of an accident, that or local illness or local maladies, right? Yeah, sure. I'll be little slow. So an eruption of keratitis or an appendicitis, etc., are of localized affections. So here the term appendicitis, right? Appendicitis. There is one remedy which has beautiful action. I did especially 2 or 3 cases, that is iris 10x, especially in appendicitis pain in low potency. It works wonders. Iris 10x. It is not iris versicolor. It is iris 10x from the same family. Among these localized maladies, there are, for instance, warts, discolorations, strepsils, or any eye pathological abscess, hemorrhoids, and alopecia. Now see this, the illness defective because of the patient. There are illness defective from the patient, illness defective from the doctor, and illness defective from the symptoms. These three illness defectives are very, very important to understand. And this is same was if you read Stuart Close philosophy from organon medicine, he write obstacles for cure actually. Obstacles for cure in the patient, obstacles for the cure in the doctor, obstacles from the cure from the remedies. So the same pattern runs here. So because now we are into the patient, right? Because there is a lack of real symptoms expressed by the patient tells you what is wrong with him. I cannot sleep. I have no appetite. I feel tired. What can you do with these symptoms like those? Right? Patient says, I cannot sleep. If you ask, how about your sleep? I'm not getting sleep. Okay, you just write, I'm not getting sleep. That is not why the patient is not getting sleep. What exactly the patient going on? You ask, what are the thoughts running in your mind? Patient says, doctor, now this sleeplessness problem started after love failure. So he's indicating some remedies for you, either ignitia, either nitromure, either auramure, either staph. That consequence, the way you question is more important there. So patient defectiveness will be there, but as a physician, we need to catch hold what exactly going through, what was the background behind this. I have no appetite. Why patient doesn't have an appetite? Because the pineal axis of endocrinal system is not stimulating. So what exactly happening there? I feel tired. So why you feel tired? What is happening in your body? At which situations you feel tired? No, doctor, you said tired now. So whenever I climb the stairs now, I feel lot of weakness. I cannot able to climb the stairs. I feel weak and I get breathlessness. He's indicating you the remedy that is calcarea carb or kali carb. That you need to catch hold of it. So all the vague symptoms, what patient is telling you, try to concentrate on that. Try to dig on that. You will get the remedy. Now coming to illness defective because of the doctor. There are defective because of lack of symptoms discovered and collected by the practicing homeopath. In this case, we must consider different insufficiencies. So here you see, patient said, how is your sleep? My sleep is not good. So you write sleep is not good. How is your appetite? It's not that much. Okay. So here you see, you're not at all interrogating the patient. Why, what happened, what exactly the patient is going through. So that illness defect is coming under the physician bias. Next, the illness which are defective by their symptoms. These are the illness which do not show by themselves. So Hahnemann describes in 176 and 156 aphorisms. In one-sided diseases of the first, it is often to be attributed to the medical observer want of discriminate that he does not fully discover the symptoms actually present, which could enable him to complete the sketch of the portrait of the disease. Portrait of the disease. Here, we need to understand what are the patient symptoms, what is the disease symptoms. This differentiation will tell you what is common, what is uncommon, what to be taken for repertory, what to be taken for rubric adding. That comes in the understanding of the disease symptom or understanding of the patient disease, patient symptoms. So there are, however, still few diseases which after the most careful initial examination, that is from the case taking aphorism 84 to 104 or 98 present, but one or two are so severe and violent symptoms, while all others are but indistantly perceptible. I'll tell you one beautiful example. For example, if a patient comes in front of you and he has a USG abdomen, and there you noticed that he has severe gallstone colic, gallstones, and he tells doctor, I'm getting severe pain, cannot able to sit, cannot able to walk, and this is the report, and in report there is gallstones. Now here the symptom is more often a disease pattern that causing him a lot of pain. Now you need to make the patient examine what is severe or violent symptoms that need to be subsided very, very frequent or very rapidly. So gallstone colic, one of the beautiful remedy you can think of is China officinalis. China, gallstone colic. Even podophyllum also have this action, but China in high grade remedy, give in frequent doses, it will clear the subside the pain. So The first translation of organon in fact tells us something which we have never understood, that is the one recognizes the illness in three manifestations. So if you go into the organon of first edition, many of you have these come across these the three, that is signs, accidents and symptoms. So on these basis homeopathy runs. I ranked my brain for a long time trying to find out just what these three things mean. So now we are coming into subjective symptoms. What are subjective? What are objective? Subjective symptoms felt by the patient himself. Symptoms often not objectively verifiable and very often minimized, neglected by the treating doctor. So here we need to give equal importance for the subjective symptoms and equal importance for objective symptoms. Homeopathy is always interested in subjective symptoms because it is interested in the patient, in his personal reactions, in everything concerning him, while ordinary medicine is interested in the illness to make a diagnosis for which treatment will subsequently be prescribed. I'll tell you one example. For example, if a patient comes in front of you, please guess the remedy and watch what I am doing. Patient comes in front of you and says, Doctor, I have so much of liver and abdomen pain here now, here, so much of pain. But if I rub like this, I feel much better. If I rub on the part, I feel much better. What could be the remedy? This is subjective. This is especially for the patient. He is saying, Doctor, I'm getting severe pain on the stomach or abdomen. I don't know. But if I rub it, I feel so much better. That is conformed to the subjective. That is PQRS. So that you need to understand. Yes, cheridonium and podo. The remedy is podophyllum, especially in rubbing amel on the liver regions. Podophyllum works wonders. This is only to the patient in front of you. That subjective symptom you need to understand. I'll tell you one more example. Doctor, when I start cough now, when I have this cough, immediately my hands go and I grasp my genitals. I don't know why. When I cough, I grasp my genitals. What could be the remedy? Cough while grasping the genitals. Right, the remedy is zincum metallicum. Zincum metallicum. So these you need to understand. See, it is not finding the remedy through some mechanical aid. It is not finding the remedy by some mechanical aid coming with 3 or 4 remedies in the repertory sheet and you start confirming them. Then patient says, yes, doctor, I have these symptoms. Yes, doctor, I have these symptoms. This is not homeopathy. This is not homeopathy. When patient about to enter in your cabin, by the way of walk, the way he sit, the way that he tell the symptoms, the way he gestures, everything is important. Everything is important. This you need to understand. When you catch hold of the subjective symptoms of the patient, your remedy works wonders. Your remedy works wonders. Now coming to the signs or objective symptoms that can be measured or auscultated, felt, verified, identified, seen, and pursued by all the means at our disposal, either by our senses or by the microscope or all the apparatus used to detect the symptoms or all the means known to the laboratory. I'll tell you one more example of phosphorus actually. So how you can identify a phosphorus child? Can anyone text in the chat box? A prosperous child come into your clinic and he says, hi doctor, that is the first meet. He's not come for the first follow-up or second follow-up. Very new patient, tell hi doctor, and he comes and he grabs the steps or he grabs some other things and he starts working. So that is prosperous child. That is prosperous child. That is objective symptoms. You need to be seen, you need to be identified, you need to be felt the aura of the patient there and then itself. Very, very magnetized, very, very extroverted, desire to be magnetized, prosperous. And when going also, patient says, bye doctor, bye. Such thing you need to understand. Coming to Barrett Cup, not able to speak, not able to have eye contact. Whenever asked what is your symptom, he'll say like this to the parent, mom, I am having cough. Then the parent will convey to the doctor that he is having some cough. This is shyness, timidity. If you confirm this shyness, timidity, can be Barrett Cup, can be Silesia. Can be some other remedies there. These you need to understand. Or if a patient comes into the aura of your clinic, and especially someone has on the music, or if you got a phone, then the music rings, then the patient dances. Tarantula, desire for music, desires for dance for the rhythms. Very, very restless, very, very suspicious. So these objective symptoms you need to identify, and you need to be studied at the relevant with materiamedica there and there. This is beauty of homeopathy. This is what we must do in almost all the clinics to flourish homeopathy. Coming to accidents or unexpected symptoms, casual or accidental symptoms, all of them are symptoms occurring from accidents, burns. So never Welsing's burns, you can think of causticum. But there are grade of remedies. For first grade of burns, you can think of urticaria urens. Second grade is calendula, canthari, sorry. Third grade is causticum. Insect bites, there are many remedies there, and wounds as well. So here examination of the patient is most important. There is also the question of symptoms that patient won't tell you willingly because they are embracing or humiliating or shameful symptoms. You will find a remarkable description of these in the organon of aphorism 93. So whenever you patient comes into your clinic, try to counsel or try to take the symptoms when the patient is alone. When they have the attendants or father, mother, brother, sister, friends, ask them to stay out of your cabin. So the patient feels better. So this embracing or this humiliating or these shameful symptoms will go away. You will get the clear picture. It is up to the doctor to discover them with tact and psychology. I must tell you that ophthalmological diagnosis often help us to great deal in this matter. I have often spoken about the fattening of the pupil at 12 o'clock in the left eye. It means static manifestation. In the right eye, it is more of depressive kind. So this is something you need to observe in ophthalmology, or not only ophthalmology, in anything. If you observe this 12 o'clock in left eye, the patient having this static manifestation. If it is the right, is very melancholic like kind of state, depressive, sadness. In the left eye, it could be indicate very vague and repressed anger. For instance, in the right, it is more of depression, sorrow. It's very deep understanding, actually. So, Hahnemann has the following to say about this in paragraph 177. In order to meet most successful sue a case as this, which is very rare occurrence, we are in the first phase to select, guided by these few symptoms, the medicines in our judgment is the most homeopathically indicated. So very few symptoms. If you get understand the match simillimum similibus curenter, that's it. So coming to the next part here, I must say that the disciplines of Kent has a great advantage. So actually, these lines are exactly taken from the book. So I am explaining it very clearly there. First, simplify by opening Kent's repertory. Then have a whole list of questions they can ask, which is to their advantage. Secondly, they know that all these questions have corresponding answers in the materiamedica, which is another advantage. So when we know our way around our repertory, there is a considerable spectrum which allow us to ask questions that a doctor without a repertory cannot know. So why this is this? What is this? What exactly Pierre Smith want to tell us is here? The subrubrics from each, for example, if you go into the section of any eye pathology or anything, abdomen pain, stomach, then there is lot, either left, right, on the middle or on the center. It is accomplished by eye symptoms, it is accomplished by hand pain, it's accomplished by some other symptoms. So that sub-rubrics from the main rubric, the sub-rubrics will give you a clear indication of what question to be asked. So that is what Pierre Smith states here. Kent repertory is very much useful in understanding case taking in more depth. In more depth. It's not only Kent's repertory. If you read Organon 6th edition very clearly, you will get a understanding of case taking very clearly, very clearly. So coming into paragraph 180, Hahnemann is describing what happens when the selected remedy is only partially homeopathic, not perfectly similar to the disease. So that is what imperfect simillimum is. Sometimes the physician selects the best possible remedy, yet it is not fully homeopathic because the totality is incomplete. or the materiamedica is still limited. This is what called accessory symptoms. When such a partial similar remedy acts, it may be introduced into some symptoms from its own medicinal picture. These are called accessory symptoms. These are called accessory symptoms. So this is mostly occurs in the first setup of the patient, where patient cannot able to describe and we are just prescribing on partial symptoms of his case. So that gives you accessory symptoms. In the next follow, patient will come and tell you the whole symptom, what exactly happening there. Like for example, you this partial homeopathical remedy, I will tell you, there is vague symptoms, very vague symptoms. You're not able to find what remedy or exactly, or you have no idea of materiamedica, or you have no idea of getting into repertory. So in such cases, try to give sulfur 1 dose and tell the patient to come after that. So then the patient develops some symptoms that are called accessory symptoms. With that, patient tells the subjective and objective symptoms what he or she is undergoing there. Then the case will open up. Then your remedy will match to your totality or the constitution. But these are not foreign symptoms. Hahnemann explains that these symptoms are also symptoms of the disease itself, but very latent, indecent, rare, or never noticed before. So this is what you have prescribed some remedy that will act on the vital force of the patient, and the vital force comes into the state from the latent, come to the state of flourishing the symptoms. Then patient experience some difficulty. Then patient experience some pain. Then patient expresses some happiness or some sadness. In the next follow-up, patient tells what exactly happening before the 1 week or before the 15 days of your medicine. Bring the hidden aspects of the disease to the surface, make vague symptoms clearer, or cause previously unexperienced but disease-related symptoms to appear. In the next paragraph, do not fear these symptoms. They complete the case and guide the next prescription. This is most important for a homeopath to understand the accessory symptoms importance. This is what Hahnemann has clearly mentioned. In the next paragraph, whenever the first remedy no longer produces benefit, provided that the newly appearing symptoms are not so severe as to require immediate intervention, which is very rare, and given the extremely small doses used in homeopathy, especially in chronic diseases. The physician must re-examine the case. The current state of the disease must be carefully recorded, as it is now present as a second homeopathic remedy must be selected according to this updated condition. How beautiful he has written this. This subsequent remedy can be chosen with even the greater accuracy because the total symptom picture has now become fuller and more clearer and more defined. I'll tell you one beautiful case. If you read the book that is Elements from Homeopathy, which was written by P. Shankaran sir, uh, who is the father of Rajan Shankaran. So P. Shankaran sir, in one of the case when he is describing about Carbovage, it was coma case actually. There is no symptoms at all. Patient is lying down, very cold. The everyone was said that he will die, but Shankaran sir started Carbovage with very frequent low doses. On the next day of the follow-up, patient aroses, the vitality of the patient aroses, and the patient is very well than before. Now, what P. Shankaran sir has did there? There is no symptoms. That is one-sided, or some accessory symptoms he need to be in. So he has given Carbovage. So generally we think we have an idea for any remedy, use sulfur, it will use something. It is not like that. You need to get some of the indications, either from the attendance about past history, either from attendance from the family history, either from attendance what exactly happened. Like for example, patient is lying on the bed with some diseases. Patient is not able to speak or something. Try to examine him. How the temperature? If he is lot of coldness, everywhere there is lot of coldness. Think of 3 remedies: Carbovage, camphor, verastrum. These 3 will help for you because of coldness, lot of coldness, and understand the attendance. What exactly has happened there? Or if a patient comes into you with lot of fever, patient unable to say any symptom, you examine the head and foot. If head is hot, feet is cold, the remedy is arnica. This is beauty of homeopathy. This is beauty of homeopathy. This you need to understand. When despite of correct case taking and proper remedy selection, there is little or no response, Hahnemann raises the important issue of lack of reaction. Now we are entering into the part of materiamedica beautifully. What is this lack of reaction? This situation must be carefully analyzed and not immediately attributed to an error in the prescribing. According to Organon, absence of the reaction can arise under different circumstances, and the physician must first understand what or which situation is present. So Hahnemann distinguished between two broader categories. In the first, the remedy is only imperfectly homeopathic. In such cases, accessory symptoms may appear, which help to complete the symptom picture and guide for the next prescription. The second category, the remedy is truly well chosen based on through case taking, genuine drug preparation, clear correspondence with the patient present symptoms, yet the patient still fails to react. Right? Most of the people come into the second category. I feel we have done good case taking, we have done good understanding of the patient, we have given good remedy, but there is no reaction at all. So here comes the potency role, actually the potency role. So basically from my point of view and my experience, in my clinic right now, I am only using LM potencies, and the two in aqua doses. So if you have want to know the knowledge of understanding this LM potencies, try to read aphorism 247, 248, and what is this actually the aqua dose, the water dose. So still today, I never prescribed any dry pills to any patient, and no mother teachers, no biochemics. Only aqua dose, water dose gives you beautiful results. That lack of reaction, what Hahnemann has mentioned, has completely covered in sixth edition, 247, 248 aphorisms. Try to read it, try to understand it very carefully. The well selected remedy why we are failing is due to not understanding of these 247, 248 aphorisms what Hahnemann has mentioned in sixth edition. If you are following dry pills, you are in the fifth edition of Organon of Medicine. So in this later situation, the problem lies. I'll answer all your questions at the end of this session. Please keep your questions aside. Surely I will answer when the session is about to end. In the later situation, the problem lies not in the remedy, but in the paralyzed state of vital force. The organism is unable to respond even to correctly selected homeopathic stimulus. For such cases, Hahnemann points to opium as an indicated remedy. Opium corresponds to the state of stupor, suspended reactivity, as it respects to paralysis of nervous, muscular, sphincteric functions. By matching this state, opium can help restore the capacity to react. So coming into the state here, the upper line was written from the book is Bryonia, calcaria iode, cypridinum, tuberculinum, X-ray, zincum. And when too many drugs have produced a state of hypersensitivity and the remedy fails, you have to think of phosphoric acid and above all Chukram marum virum. See this, how beautifully Chukram marum virum, if you read from Boric actually, here it is written, oversensitiveness from the abuse of medicines and when remedies fails to act. It is not for the prescription of modern medicines. It is for the prescription of homeopaths. Like you have given n number of homeopathic medicines, patient is not at all able to react, not at all able to get some symptoms. That oversensitiveness from the abuse of drugs when the remedies fails to act. Think of the remedy Chukram marum virum. The other remedy he has mentioned is phosphoric acid, but above all TMV. And it's a beautiful remedy, tukram for polyps, nasal polyps, especially if you read E.B. Nash literature, that is therapeutic leaders of therapeutics by Nash. He has mentioned to give this remedy in 50 ml, one single dose. So there are some other remedies from Fatak. Reaction, lack of pour. The three-grade remedies are copromet, opium, as Hahnemann said, sulfur, syphilinum, sorinum, and zincum. So I'll tell you about X-ray. I had a very good experience of using X-ray in 0/1, especially in almost all psoriasis cases or in vitiligo cases where my remedy of constitution is going well, the reaction is very well. Even in some in some situations, I give X-ray LM 0/1, just one dose. That will stimulate the lack of reaction. And X-ray is a beautiful remedy if you're not at all getting any reaction from any medicines. Try to give X-ray LM potency 0/1 or 201 dose. It has beautiful action. If you want to know more about X-ray, try to read the book or a booklet, from SPD, SPD, DEY, SPD, X-ray from SPD, with lot of cases as well. And from Boric also, he has written very beautifully about this remedy. Next, in intermediate fevers that has been spoiled by a whole lot of drugs, you have a rubric which indicates several drugs among which you find CPR. See, intermediate chronic spoiled. What is meaning of spoiled? We have given n number of remedies, we have given n number of antibiotics, but there is no helping in the intermediate fevers. Then you can think of CPR there. High grade remedy. See this rubric: intermediate chronic fever, intermediate chronic spoiled. 9 remedies, among that is CPR. So if you want to prescribe Ipecac, clean tongue. Fever with clean tongue, that you need to understand there. Tarantula with fever, lot of restlessness. Calcarea with fever, with lot of perspiration, especially on the head. Desires for egg. So this beauty you need to understand. See, it is not just selecting one rubric and you which is high grade. That never works. Understand the patient, understand the symptoms which patient is falling from. What are some physical generals there? Ipecac, physical general, as I said, clean tongue, tarantula, restlessness with fever, calcarea with lot of profuse perspiration, weakness. With this, you can think of calcarea cough. Then comes the reactive remedies. These reactive remedies will either open up the case, bring about an initial improvement that can be followed by later on, or else more often they will not seem to produce any immediate result. But afterwards, the patient will feel an indefeasible improvement in himself. And the repetition of the drug, which started the improvement in the beginning and then seems to stop acting, will bring about a new improvement and sustain improvement. So these reactive remedies, what are there, how the reactive remedies of Pierre Smith has differentiated, we'll go into this very clearly. What are these reactive remedies actually? So coming to the reactive remedies for old aged, he said for old age. So in Kent's repertory, look under old people or aged people or old age. There are 2 excellent reactive remedies for elderly persons. One is Ambrogesia, other one is TMV, that is Tucrum maranvirum, which you will give if you have some symptoms indicating them. How beautifully Pierre Smith said here is, it is not blindly giving this to anyone. It is not that. It is not homeopathy. He says, which you will give if you have some symptoms indicating them. If it is indicated, it will work. Not blindly, Ambrogesia, you take morning, Tucrum verum, you take afternoon, again Ambrogesia in the evening, Tucrum verum in the night. It doesn't work until and unless there is an indicated, any one minute indication. So what is Ambrogesia actually? It is suitable especially for elder people and patients who are weakened by age or as a result of overwork. These people are hypersensitive, exhausted, nearly always have insomnia because of worry and have to get up at night. So insomnia due to worry, like KP, Calipos. Lot of mental exertion you can see in umbraglacia. Usually there is aggravation from music which they don't like and which makes them weep. Crocty and Fussy, they hate anything which is out of the ordinary routine of their lives and disturb their habits. Like cannabis indica and glononine, for them time passes too slowly. If it passes too quickly, it is cocculus indicas again. A lot of care, night watching is cocculus. They are nervous, intern, shy, cannot do anything in the presence of someone else. They desire to be alone. Nervous, excitable infants, a lot of loquacious subjects. This you see, a great remedy for elder people, disgust with life, people hating strangers, and everything new. Everything new. So they are into the state of melancholic, sad, depression, worry. These patients usually suffer on one side only, usually the right sided, but also the right side on the top and the left side at the bottom. This is umbraglacia. This is umbraglacia. I'll tell you one beautiful clinical tip. Like in a patient where patient says, doctor, na, especially in COVID, you have come across this. Doctor, na, recently my grandmother died. Then after within 2 or 3 months, my grandfather died. Then after that, my brother died. Then after that, my sister died. So recurrent deaths in a family, patient comes into your clinic, he is umbraglacia. Wonderful, beautiful tip. It has does wonders. Coming into tucramaramviram, we all know is a great remedy, as I said. When the great number of drugs administered has produced a state of hypersensitivity, with the result that no remedy, even if it is indicated, acts specific action on the nose and on the rectum. Generally speaks, patient who need TMV, that is tucramaramviram, has dry, chapped skin like sarsaparilla and have suffered in their infancy from mucus polyps. Like polyps is more of lemna minor, formica rufa. There are more remedies. Somewhere in the nose or in the nasopharynx or in the womb or in the bladder or in the rectum. And it is a wonderful remedy for fibroid tumors if it is indicated. Childhood complaints, a nose that is always stuffy, oozing, loss of smell, you can see here, coryza with blocked nose. One of the remedies that has the sensation of internal trembling. These patients are prone to hiccups and nearly always have the post-nasal passage blocked, constant hiccup while eating or after lactation. How beautiful. Musty taste in the mouth, especially in hiccup cases, you can think of this remedy. There is one rubric from synthesis, I just remember. Mind, sadness, hiccups from. From hiccups, patient going to the state of sadness, single remedy ruta. It is single remedy rubric from synthesis. Now, coming to the reactive remedies of cardiopulmonary patients. The one remedy, as I previously described, what P. Shankaran sir has done, one beautiful case, that is the remedy that is carbovage. This remedy is a classic for subjects who have never recovered their health after a severe illness. So that is what never well sings any illness. The one remedy you can think of this is carbovage, and from Fatak repertory, it is single remedy, never well sings, single remedy carbovage. This is one of those cleaning remedies, a great drainager. In that case, give 10 m potency, which works particularly well. So here 10 m, the experience of Pierre Smith is saying 10 m works particularly well. A reactive remedy for defective reactions. Remember that in the carbovage patient, everything is cold. The end of the nose, the extremities, the hands, feet, face, teeth, mouth, breath, everything is cold. Not only cold, even icy, except for the head, which is often hot. Again, here you are indicating like arnica there. In spite of this typical cold with lot of venositis, lot of cyanosis, lot of bluish color appearances, he represents three very different but very, very characteristic states of carbovage are discouragement, indifference like sepia to everything without any reaction, and lot of irritability. Generally speaking, collapse, all kind of fainting following the loss of vital fluids. Aggravated by fatty food, butter, rich food, and pork. Dry ears, ear with too much of wax. I'll tell you one more remedy. This is a concomitant symptom which I learned from the book that is Just You Think, which was written by Sarkar sir. He tells in almost all conium patients, conium, you ask the concomitant, there will be too much of wax in the ear. That is a confirmatory of conium. That is the confirmatory of conium. And here carbovage as well. Painful diarrhea of elderly people, excellent remedy at the beginning of whooping cough, like Drosera, like Pattusin. Carbovage nearly always feels weight on the chest, constantly oppressed, frequent, need to fan himself, need the windows wide open. He needs air so badly, open air amail or open air want of, like Pulsatilla. He has something with which to fan himself. That is the state of Carbovage. Coming to laurocirrhosis, it's also a wonderful heart remedy actually. For cardiovascular complaints with cyanosis and lot of difficulty in breathing, dyspnea, cyanosis and rails in the newborns, laurocirrhosis has done wonders. The cold is not amazed by heat, the pulse remains small and faint, the patient holds the heart, he always has his hand in heart. This is typical snorer with very deep sleep like catnapia. As far as the snoring is concerned, it is of lot of steroid perspiration. This remedy revivers of opium, lacanum, which are the two remedies which have the most snoring or the best snoring according to Pierre Smith. Coming to hydrocyanuric acid, it's also a wonderful remedy, comes very close to or comes above the carbovage, above the camphor, above the veratrum. A great cardiovascular remedy which is often forgotten, and yet it has always given me a remarkable results. It is and it is mostly toxic remedy actually. It is most of the toxic and most mortal poisons. For mental symptoms, it is an interesting drug. It's a great fighter, fear of everything. It also has cyanosis with collapse, but more pulmonary than cardiac. It is more of pulmonary than cardiac. Here, laurocirrhosis is more of cardiac. While carbovage, laurocirrhosis have more effect on the heart. This is the difference. And you always have to look at the pupil. The pupil of hydrocyanic acid is dilated without any reaction. In almost all coma cases, where fortunately or by blessing of your excellent work in homeopathy, you can treat coma cases and observe the pupil, it is dilated without any reaction. You can think of this remedy, hydrocyanic acid. Coming to ammonium carb, these patients do not like cleanliness at all. You may be sure that they use neither brush nor soap. They hate water. They hate using it. This doesn't mean that you will give this remedy only to patients who are dirty. Can be sulfur again, but it is not. It is not. This patient is usually sedentary, big people, always tired, exhausted for no reason at all, with heaviness in all the organs. I'll tell you one beautiful indication. If you get a patient of women who is obese and sedentary life and having history of heart complaints, blindly give ammonium carb, works wonders. Why I'm telling you blindly? That is the constitution of the patient in front of you. Obese, sedentary, heart complaints. Ammonium carb is the only remedy. Doesn't even like to touch water, let alone cold water. Sulfur doesn't like to be washed. Ammonium carb doesn't like it either, but he actually fears the contact with water, which he hates. Again, the fear of water, fear of running water, fear of seeing water, it is going to the state of hyoscyamus. I'm comparing here. Hates cold air. Always has to carry a bottle, smelling salts to avoid fainting. Epistaxis after washing face or the hands or after eating, especially at night. Marked tendency to catch cold. Nose is always blocked. The nose is especially blocked at night. With mouthy breathing, you can see. So when many patients actually in this winter, child or of 9 years, 10 years, 12 years, patient comes, doctor, now nose is blocked, he started breathing with mouth. Some remedies I'll tell you. This is one of the remedy. The other remedy is antium tot. The other remedy is Sambucus nigra. The other remedy is Sinapis nigra. The other remedy is Tiktapi. This works wonders, especially in this winter season with nose blockage, and they try to breathe through mouth. Lips cracked, cracks in the corners of mouth like Kondurango. And Contorango is a beautiful remedy for C of esophagus, cancer of esophagus, and cancer of breast. I think it will be coming into the next session. Crack in the middle of the lower lip, like nitramur and like pulsatilla. See, this is subjective symptoms. These you need to understand. So I almost all have a knowledge on each of these remedies. The subject is rather chesty, asthmatic, always out of breath with lot of noisy breathing that is more or less audible. A great remedy for emphysema. It's a great remedy for emphysema. And all the pains are amelled by external pressure like Macpos and Colocint. But Macpos, Colocint, neuralgic remedies. Coming to the tarantula, this drug is very, very much neglected and it is pity. First of all, it is one of the most agitated of the drugs. You cannot sit still, he cannot stay in one place, must move about, especially at night, syndrome of legs will not rest, constant fidgetity like zincum. You must remember also that this fidgetity is both at the physical and mental. But zincum fidgetity at the physical, not mental, because zincum is a brain fake remedy. Brain fake remedy. So Tarantula is a wonderful remedy, especially in ADHD and autism cases. If it is indicated, works wonders. Works wonders. The agitation is often anxious, aversion to company, but patients who respond to Tarantula always want someone near to them, ready to help them. Always dissatisfied, very changeable moods. These people are difficult to live with, whether child or adults. Pre-cordial anguish with constriction, palpitations with the feeling that the heart is squeezed. It's a huge polycross remedy, but remember restlessness, want of music, want of rhythmic dance, spider group like symptoms. That is tarantula. Coming to the reaction for nervous subjects. If you're coming to the nervous, the one of the beautiful remedy is gelsemium. The 3 Ds, dizzy, drowsy, dull. If you get this, he is gelsemium. It works wonders. When you see somebody, especially after flu, who is dizzy and always drowsy, no thirst, no appetite, dull, think of this remedy. Frequent urination, abundant urination, which relieves headaches. Gelsemium patients, especially feverish patients, complain that everything is trembling, and it's a great remedy for trembling, especially of external trembling. And gelsemium aliments from bad news, aliments from shock. You can think of this remedy. Aggravation by all emotions, a great fearful remedy. Always a terrible fear before examinations, like Celicia. But in Celicia, the patient is not dull, dizzy, drowsy. Celicia patient, even though before that exam, they go into the state of anxiety, whether I will pass, I must rank first, I must success. That is the kind of Celicia. That is a mineral remedy. And with a lot of perspiration, the palms and soles is a key confirmatory for Celicia. This remedy is very successful when it is prescribed as a specific for fear of examinations. I give a dose of 200 the morning of the examination, and if this fear of the examination is very pronounced, a dose even the day before in the evening. More often than not, that is admirably successful. I don't even have to repeat it afterwards. Gelsemium is very, very apprehensive, very, very frightened, easily frightened of death, remarkable after fear and emotions. So, and if you go into the rubric mind elements from anticipatory anxiety, gelsemium is one of the high grade remedy, argentum nitricum and medorinum. And gelsemium, argentum nitricum in this anticipatory anxiety, in this fear, they are very, very close, very, very close. But the difference is argentum nitricum is restless, anxious, gelsemium dull, this drowsy. That is two differences. If you want to understand this difference of gelsemium argentum nitricum, try to read from the Soul of Remedies, which was written by Rajan Shankaran sir in Gelsemium Remedy, third or fourth paragraph. I remember sir has given beautiful explanation of this anticipatory anxiety difference between gelsemium and argentum nitricum. Want to be left in peace, agoraphobia, fear of walking across large open spaces, fear of alone, want someone near, even someone who doesn't speak, fear of going into mountain, elevators, even going down. So it has terrible fears like phosphorus, like calcarea carb, right? This is more or about gelsemium. I'll go some fast because some of the known remedies are here. Coming to the capsicum, this drug is not chili, as you will see it is stated in many materiamedicas, but it is on the other hand is aggravated by the cold, and the slightest draft is which is important, you have to remember. And capsicum patients is a lot of fabby, obese, you can see, and it is wonderful remedy in whole materiamedica for homesickness. For homesickness, here it is written a lack of reaction in obese patients, and this line was taken from Fatak. And I also added some of the interesting symptoms of this remedy from different books actually, to understand it exactly what it is. And dyspnea of elderly people and homesickness with obese, you can think of this remedy, capsicum. And I'll tell you capsicum, actually, whenever I think of capsicum, there is one rubric from Fatak. Patient says, doctor, while coughing, I get joint pains, I get hand pains, I get stomach pains. Whenever I cough, I get different type of pains. Cough with distant parts. Single remedy capsicum. Single remedy capsicum. It has worked for me. It has worked for me. It is not related to this respiratory, but patient says, doctor, I'll coughing, I'll get hand pain, I'll get leg pain, I'll get head pain. Pain at distant parts. Single remedy capsicum. This is the beauty of Fatak repertory, how beautifully Fatak repertory has designed. If you go and understand in depth of Fatak repertory, it is amazing, amazing, and you get lot of remedies, lot of successful remedies, and very few remedies as Fatak has mentioned. Coming to Kent, he has mentioned n number of remedies, but Fatak has mentioned very few, very exactness with few remedies. Repertory is Fatak. Other repertory you can think of is nerve repertory. It is based on hearing guiding symptoms. There is localization for which this remedy is very successful. The mastide, 1 or 2 dose of 200 potency, and the threatening of mastides disappear rapidly. This remedy acts very quickly, very well in smokers and drinkers who suffer from sore throat and the pain that goes to ears with fetid breath. Beautiful, beautiful, right? Sore throat, pain going to ears. The other remedy is phytoleca and lacanina. This you need to remember. But especially in smokers and drinkers, sore throat, it's capsicum. It's capsicum. Expulsive cough, as if everything were going to explode. Head, ear, bladder, chest, sciatica aggravated from coughing, hoarseness, voice of public speakers, ministries, and singers. Only cough has caused the whole body derangement is only remedy capsicum. Coming to Valeriana officinalis, it's a more historical remedy than any remedy in Metroamerica, more than Ignitia, above Ignitia in historical Valeriana officinalis. I'll tell you Valeriana officinalis, especially in sciatica cases, patient says, doctor, early morning, I cannot able to keep my foot on the floor. इतना आग लगता है that the patient will say, whenever I keep my foot on the floor, from down to up, I'll get a sensation, such a pain I cannot able to feel. Ascending pains, ledum and valeriana. When it is dynamized, this plant has an affinity with subjects who have extremely variable temperament. Very, very historical remedy, I'll tell you. Very, very historical. This remedy has a sensation as if they were threatening hanging in the throat. Excellent drug for babies who vomit great pieces of cuddle milk after feeding. Valeriana. Coming to calcarea carb, it's a huge remedy, huge remedy. I'll explain you in gist because we cannot cover up in such time. It's a wonderful, wonderful remedy. And there is one cycle that is sulfur, calcarea, lycopodium. Everyone knows that is follow-up cycles. And calcarea produces goiters and cures them. This is one of a clear indication. If you open Fatak repertory, dysfunction thyroid, single remedy calcarea carb. Great remedy for very shy people. And calcarea carb have lot of fears. Why they have lot of fears is this is coming from the oyster shell. They want protection. Everything need to be protected, either at the security, either at the money level, either at the relationship. Everything they need to have protection. That is calcarea carb. It comes from the row 4 of the periodic table. And especially in ladies who having late marriages, they can fall into the category of calcarea carb because they feel that my protection is going to lost. How I can survive? That's why they go into end in the late marriages. Has many fears like phosphorus, and my teacher taught me this is important. When any case has more than three fears, one can almost always say that either calcarea or phosphorus is indicated. One condition, of course, that we are not speaking about a mental case, because it is very difficult those to eliminate everything which can be pathognomic, right? And coming to fears, lot of fears: heart disease, tuberculosis, disaster, cannot able to see horror films, fear of pins, fear of injections, fear of dogs, crowded places, death fear, and calcarea cup clear indication twilight aggravation, especially evening aggravations with calcarea like symptoms, blindly prescribed calcarea cup. Twilight is nothing but is a word used in the repertory for evening aggravations. Evening aggravations. This is what that classical symptom of calcarea is horrible visions at the moment of falling asleep. Horrible dreams. Patients say horrible dreams. I cannot able to explain, doctor, especially about sleep. And patient have this kind of fear, security, protection. And I'll tell you, calcarea carb is not the patient who is obese. He can be thin. He can be thin. And they craves for boiled eggs. When patient who smokes suddenly loses his taste for cigarettes or cigarettes, think of calcarea carb. Interesting, right? This remedy loves good wine, liquors, cold drinks, but on other hand, prefers milk when it is very hot. Very hot. I'll tell you, hot tea, hot drinks, hot. The fumes must come out of that. If that is the case, the remedy is chelidonium. Chelidonium prefers very hot drinks. He loves everything which is salty, sour. It's a very good remedy if, in addition to these general characters, the patient suffer from polyps. Calcarea infants sometimes have enormous stool, and once wonder how it is possible for infants to expel such stools. Coming to reactive remedies of organoneuric nervous complaints, for squilla of paralysis, apoplexia, exhaustion, and all cerebrospinal affections, you can think of these three remedies: zincum, conium, and helleborus. Reactive remedies for cutaneous affections. In this also zincum is there, the remedy of choice for the results of all the eruptions that have been suppressed by any means, whether external or internal, varicose veins on the legs, thighs, varicose veins of pregnancy, which have the characteristic of being painful, burning pain on the wounds. Zincum discharges amel, that is the key confirmatory for zincum. Agitation of legs, of the feet, especially of the feet, the syndrome of legs that are restless like tarantula, rostox, and causticum. Sweating of the feet with lot of exoration between the toes. And this remedy has a very special kind of purities. Its purities on the popliteal spaces with or without lesion, like dolichos. Itching without eruptions can be. Eczema, especially behind ears. Eczema behind ears, I get beautiful results with delirium met. And other remedy you can think of is nitromur. But teliramet is high grade remedy. If you find this eczema, especially behind ears with fungal infection, give telirium at 30. The child holds the genitals while coughing. That is what I explained about zincum. Uh, Nerium oleander, not much known about this remedy. As you know, this is often used as a decoration, and we find it growing in the large pots in outdoor caves with pretty pink and white flowers. It acts on the nervous system and brings about the first of painless paralysis. It acts on the heart, bring about anxious and violent palpitations. It acts on skin, bringing to toes about purities, and it's more of a skin remedy actually, and better from scratching. It is not much known, and I have searched some literature, but I'm not yet finding about this remedy. Right. Coming to next, reactive remedies of digestive states. The first remedy is phosphoric acid. Is a remedy of weakness, lack of vitality. As I said in the first, that is lack of reaction. Phosphoric acid is one remedy, right? Growing children who are always tired, sneezing, exhausted, doesn't do any work at school, indicated after many acute illness which has followed and are in rapid succession, loss of vital fluids, or after breastfeeding. It is simple. Understand phosphorus, understand acid group, that is phosphoric acid. Why there is loss of vital, why there is lack of reaction? Because of acid involvement. What is phosphorus? Craves for love, craves for sympathy. So that's why they have this disappointment of love, homesickness, indifference, excessive sorrows. And this is what fermented dyspepsia bites his tongue, especially at night during sleep. Frequent diarrhea, which do not exhaust. He is tired from everything, but not from having diarrhea. How beautiful is phosphoric acid is one remedy with lot of weakness, lot of exhaustion, loss of vital fluids. But what he is saying here, diarrhea, but not going to the state of this loss of vital fluids. Except this, everything is okay for phosphoric acid. Great thirst for fruits and juicy things and cool drinks. And most probably, I'll confirm how phosphorus is because I'll ask, do you like fruits? Patient says fruits. Okay, what fruits you like? Banana, so and so. You like eating fruits or making it juice? No, no, doctor. I like juicy things. Can be phosphoric acid. Thirst for cold milk like phosphorus and tuberculinum. Neuratic pains in ghost limbs after amputation. Revives the pains of cancer like hydrostis here. Like hydrostis. Hair prematurely gray. So coming into nosodes here, actually I just want to end here. It was high time, but nosodes we already have prepared other PPT for understanding of nosodes very clearly, how nosode works, what is its action. We'll go into the other thing of this. Nosode is also one of the reactive remedies, but I'll give you a gist uh, I'll tell you one of the clinical tips I have write somewhere. So these are some clinical tips I want to tell you here. So nosodes is nothing but when there is no reaction in the patients, or if you have a past history of tuberculosis or diabetes, in such cases nosodes can be prescribed. Actually, it's a big topic, but we already made a PPT about nosodes. In coming session, surely we'll explain each nosode very clearly, very clearly. So these are some clinical tips. In chronic sprains, think of Strontiana carb 10 and Strontiana carb is a wonderful remedy for post-operative weakness. Post-operative weakness, Strontiana carb, and ankle swelling, edematous ankle swelling after any injury, any sprain, think of Strontiana carb. I'll tell you, Strontiana carb is a wonderful remedy. If you prescribe calcarea carb to a patient, he is pakka calcarea carb, but there is only slightest improvement. Then you shift to Strontiana carb 201 dose. It will work because Strontiana carb has element of calcarea carb. Weakness, ankle, children learning to walk. Only remedy carbo animal is there. Here you see where we have fractures. Of course, we have to assure the mechanical replacement of the fractured bones. But after these, homeopathic remedies considerably aid osteogenesis and shorten the time of kindling. Usually, I give all my patients with fractures is Symphytum 30 liquid 6 drops 3 times a day for a month. If there are no other personal symptoms, you will find fractures on under slow repair of broken bones. You can add the rubric fractures just before freezing with the following remedies. Calcarea pos is a wonderful remedy. Calendula, ruta, silicia, symphytum. Works wonders. Slow repair, you can add calendula and ferrum, add iodum and manganum aceticum, meserium, ruta, symphytum, and add thyroidinum according to Clerk. If we have retarded ossification in children's, think of calcarea floor, calcarea fos, and silicia. Next, for insomnia after fractures or after surgery, think of Sticta-P. So this is what post-operative sleeplessness. Sticta-P is single remedy from complete repertory, and post-operative with lot of weakness, Strontiana carb. And post-operative side effects, you can think of Staphysagree there. And never well sinks, or even though you given these remedies, but nothing of helping, then you shift to carbohydrate because never well sinks some acutes. For conditions and for nerves, add Bellis-P. For conditions of soft parts, hemimillus and symphytum. In conditions of tendons, add calendula. Boric indicates there are some other remedies, that is acetic acid, arnica, Bellis-P, conium, ignitia, and euphrasia. Hemimillus, hypericum, ledum, rustox, ruta, sulfuric acid, symphytum, verbeculum are for the chronic results of traumatic conditions. Like arnica is there, carbovate, cicuta. Cicuta is more of convalescence remedy with lot of nervous affections. Conium is also wonderful remedy there. especially if old maid bachelors with lot of sexual excess, glolanine with lot of headaches, hemimillus. It's a wonderful remedy. Actually, hemimillus is a beautiful remedy for hemorrhagic tendencies. Hypericum, hypericum is a nervous remedy. Ledum, especially the injured part is cold. That is a key indication to prescribe ledum and ascending pains. Nitrum sulf, I tell you, nitrum sulf is a beautiful remedy for headaches, especially after any injury. Any injury, patient gets headache, injury to head, then they have some complaints. Nitrum sulf, the other remedy you can think of Helleborus. And nitrum sulf is a wonderful remedy for psychotic asthma. Psychotic asthma, along with the medoridum. Strontiana carb, we already discussed. Coming into wounds, under these rubric, you can add lacerated with carboanimalis, arnica, calendula, hemimillus. So everything is same there here. Under bites, you see, under bites, especially of any bites, senega, snake bites, stuja, bleeding freely after bites, ammonium carb you can think of, drosera there, hemimillus, lactoductus macitans. It's a wonderful remedy actually, especially in chest pains, especially in angina pairs, you can think of this remedy. Nitric acid, phosphoric acid, sanguza. Sanguza is nothing but a hirudo. It works wonders in almost active and passive hemorrhages. Like you have prescribed hemimillus in hemorrhoids, or you have prescribed asculus, or you have prescribed some other remedies of hemorrhagic tendency from snake groups. Nothing is helping. Think of sanguza. Its other name is hirudo. It works wonders. It works wonders. So you can take screenshot. We'll be sharing this PPT as well. These are some remedies for painful injections, injured parts. This is what I said. See, if the injured part feels cold and the patient is too objective touch, that is ledum. And with ascending pains, as I said. Burns from X-rays, calcarea floor, X-ray. Burns fail to heal or ill effects, that is carbolic acid and causticum. I said no 3-grade remedies for urticaria urens, cantharis we can think of. The other remedy is causticum. Here you see other remedy, Grindelia. Grindelia is a wonderful remedy for asthmatic complaints, respiratory. It comes very close to arsenicol. If you have prescribed arsenicol, it exactly matching to arsenicol symptoms of respiratory, but not working. Think of Grindelia robusta. Grindelia robusta. A remedy which has often brought me success, or which you can add under quilling of lids. That is Arania and Patrickson. Dysentrico often succeeds also. This is a bowel nozzle. I'll tell you, Dysentrico is a beautiful remedy. If you prescribe argentum nitricum, patient is argentum nitricum, but helping partially. Think of Dysentrico. Dysentrico bowel nozzle is exact polycrust of argentum nitricum. It's a bowel nozzle. These are the patients who have constant headaches. They never stop. There are 2 rubrics: chronic headaches, ammonium carb, ars, causticum. There are, every remedy will be repeating actually. Conium, silicia, sulfur, and tuberculinum. And constant continued headaches. For these kind of headaches, there is a no sword which may think and you may help for much. That is meningococcinum. If you failed in prescribing n number of remedies for headaches, think of this remedy, meningococcinum. And you have headaches after haircuts, exactly belladonna, glolanine, ledum, pulsatilla, sabadilla, sepia. It is not to prescribe that, but it is just for knowledge purpose, and you need to confirm any one indication from the patient. For astigmatism, especially for eye reflection, tuberculum is a wonderful remedy, single remedy there. And marginal blepharitis is often well taken care by Bacillinum 30 once a week. Falling of eyelashes and eyebrows. So under salivation, add the following rubrics and the remedies. Salivation, especially at night, Mercor is a wonderful remedy, which is acrid, lactose, and merc. Salivation with lot of angina, it is Beretamur. Salivation with apathy, with indifference, Helleborus, Mercor, Nitromur. Apoplexia in anacardium and Noxomica. Salivation in asthma patients, it is Carbovage. So thank you all. Thank you. If you have any doubts, you can, and please scan our YouTube and WhatsApp so that you can join and you will get updates of us. And this session will be uploading in YouTube as well. If you have any doubts, you can text in the chat box. And please, everyone, please share your feedbacks. We want your feedbacks for the next set of this encouragement will help a lot. and please share your feedbacks here. This is our groups. You can have a scan it, and everyone please share your feedbacks. The source of meningococcium is from Pierre Schmidt from the book of Defective Illness. And how was the session? Please share your feedback, please. Yes, one of the doctor has said, I had a case with no symptoms, just coldness of the injured part was there and the remedy helped beautifully. Yes, that is the understanding of these objective symptoms that you need to understand well. It's a great experience. I think it was from Dr. Yash Vardhan Jain. He's my brother and he's practicing classical homeopathy as well. If you have any doubts, you can text. Can be actually meningeal headaches can be of any febrile origin. If it is of febrile origin and with headaches, you can think of cicuta, some other remedies which is of nervous affections. It can be as well simple migraine as well. Yes, LM potency I will explain in upcoming sessions. How to practice classical homeopathy, sir? I was not understanding. You can scan our iPhone. I don't know the name. You can scan our website, WhatsApp channel, or you can text me individually. Surely, I will help in that. About clinical research, it is going to release in YouTube very soon. And one of the doctor has asked, I think, you never prescribe mother teachers. Yeah, actually I don't prescribe mother teachers because it's a crude form, right? It's a crude form. And actually there is one proving done by some of the doctor. I don't remember exactly. He has taken n number of mother teachers and at last he has diagnosed with a liver failure. So it's a crude form. Actually it's a crude form. From that we prepare these dilutions, 30 200s, right? So as my suggestion, mother teachers are crude form. Prescribe if it is in a dynamized potentized form. Okay, thank you. I am going to end this session. Thank you all. You can join this, and if you have any doubts about anything, you can text me individually in my WhatsApp. Please subscribe our channel and please share this link to everyone so that in upcoming sessions we can concentrate more and spread the exact classical homeopathy for you all. Thank you all. Thank you for your patience coming into here. Thank you.